There is a hole that we're all born with that goes in between the right and the left ventricles. From birth, we naturally heal that spot ourselves. Mine never did. I had open heart surgery. They went in and patched that up, and I went 35 years just, going in, seeing the doctor, getting the thumbs up, I'm okay, I leave. So I've been kind of oblivious to all this until 2015. And I passed out in my front yard, and so I got rushed to the hospital. Ever since then, I've been coming here for primary care, cardiology. I've made this my home because I've never felt more comfortable with a doctor or a team of people. I've been very lucky to be woven into this tapestry of incredible minds and with incredible hearts, and they help me get through whatever crisis I'm in. I just look at them more like family than anything now.
There are more adults with congenital heart disease than children right now. The advantage of coming to VCU and this huge academic center is that we can draw on the expertise of all our subspecialties for any complex disease or concerns that a patient may have. VCU can offer 2 adult congenital cardiologists, which is unique. Cumulative, these 2 providers have 15 to 20 years of experience taking care of the patient population. VCU has the ability to provide cardiovascular testing for these patients without doing an invasive procedure. So we're able to offer cardiac MRIs, echoes, CT scans within one umbrella to better diagnose and to more rapidly diagnose a patient.
VCU is huge, but it's also what makes VCU great because we have everyone and everything we need to care for our ACHD patients under one roof. We want VCU to be a medical home for our ACHD patients, and somewhere that the care is patient-centered, the care is coordinated, comprehensive, and easily accessible. I am here to make patients feel connected. I really try to be a constant for our patients throughout their medical journey with us. Our patients often have really complex needs, and part of our ACHD program being patient-centered is helping staff have the resources that they need to care for our patients.
The collaboration really starts with pediatric cardiology patients being transitioned to the adult congenital world. When you are an established adult congenital cardiac patient here at VCU, we are able to provide holistic care across multiple disciplines, even when it doesn't relate to your cardiac condition. This can include hepatology, a liver team, it can include an OB team, it can include the pulmonary hypertension team. Because we have such a great relationship with multiple disciplines, we don't care for just their heart defect, we care for them as a whole person.
I'm focusing on the actual makeup of the heart and the way that the valves and vessels are connected and how they interact together to get an idea of what their underlying hemodynamics or their underlying physiology is and give us an idea of what we can offer them. And some of the most advanced stuff we're doing now is actually replacing valves in the heart using these catheters, which enables us to actually do a major procedure without actually opening a person's chest. We have to be willing to talk to each other to enable the best care for these patients. And I think that's what we do best here at VCU. What I find most rewarding about my job is the ability to care for somebody from the day they're born all the way through adulthood.
Well, I'm a cardiac electrophysiologist, so I specialize in abnormal heart rhythms, which are very common in adult congenital heart disease patients. And they're a special subset of electrophysiology because their anatomy is quite different. The adult congenital team tells me explicitly what the anatomy is, Dr. Shaw and her group, and then I go through and study it and figure out the best way to treat the patient. It's great collaboration, cross-disciplinary work that's just really enjoyable. You follow them over such a long period of time, you get to know them really well. They're also very motivated, and it's just a joy to help them.
Cardiac surgery plays a small but very significant role in the care of these patients who require reoperations for either valve changes or helping with the electrical system of the heart. Over 90% of patients who had surgery in infancy now live beyond 18 years. So this is a very significant group of patients who require ongoing care. So some of them end up needing heart-liver transplants, heart-liver kidney transplants. VCU uniquely has that expertise to offer care for these very, very small subgroup but very complex patients. And it's not just physicians, it's nurses, technicians, pharmacy, laboratory services, pathology, imaging. Everybody's working together for the sake of these patients.
There's still so many ACHD patients out there that are living all over the state of Virginia, and some of them have not followed with cardiology for years. So we would like to be the home base for medical and surgical care for all ACHD patients in the area. We can increase patient access to the comprehensive subspecialty care that they need. We always aim to provide cutting-edge medical and surgical care.
I think it's rewarding to see many of these patients have lived to adulthood and they're very successful and they have had a very productive life.
Under one umbrella, VCU has the ability to care for these patients amongst their entire lifespan.